Hi, I'm Michael Bird, and you're watching the Plastic Surgery Channel.
Bariatric surgery has become increasingly popular in the last 10 years, with literally hundreds of thousands of patients receiving a variety of procedures to affect weight loss. What we're seeing, though, is a change in the type of procedures many of these patients are having done. 5 years ago, in my own practice, we would see almost all patients that underwent gastric bypass surgery, usually through an open technique, and these patients would lose 100, 200 pounds literally in a 9 to 12 month period, and the changes in their body were dramatic. These patients would come in what I always described as a deflated state. It was almost like all the stuffing was knocked out of them. And those patients, from a surgical standpoint, were the easiest to treat because it was all loose skin. Now, however, we're seeing more and more patients that undergo lap band surgery. And while lap band surgery is a very effective technique for weight loss, these patients tend not to lose weight as dramatically as bypass patients, or they won't lose the weight as quickly. As a result, we're seeing patients that are coming in perhaps at a slightly higher weight than we saw with the gastric bypass surgery, and therefore we're having to change some of the techniques and approaches that we're using in treating these patients. Many of these patients, because they haven't lost all their excess weight, may still have some residual fat or residual weight in their extremities, such as the arms and legs, and sometimes require liposuction as an initial staging procedure before you can go in there and remove the excess skin. For most of the mid-body procedures that we perform, such as lower body lifts, these can still be performed as a single stage and often as the initial stage of their reconstruction. But very often for the arms, the legs, and the back area, sometimes these areas need to be sort of thinned out with liposuction before we can really get an effective lift of these areas by doing the surgical procedures to remove the skin. It's really important to manage patient expectations properly when you initiate the discussion of these procedures with patients. 100 pounds of weight is not the same in every patient. A lot of it depends upon where they started. It's very much like when I see a patient who wants a breast augmentation and they say they want a C implant. Well, an implant for one patient may bring them to a C cup, but for another patient may bring them to a D cup because they're starting at different points. The same thing with weight loss patients. They're also starting at different points, so their end point is going to be very different depending upon where they started and how much weight they lost. Patients who come in at a higher body weight and a higher BMI, and most of the time these weight loss patients are very familiar with terminology such as BMI because this is how they qualified for weight loss surgery to begin with, and typically they had BMIs of over 40, 50, and sometimes 60, and by the time they've lost their weight, their BMI is below 35 or 30 or sometimes 25. And in an ideal world, we'd like to see patients have a BMI under 30, but sometimes we see patients that are in that 30, 32, 34 range, and this is becoming increasingly common with lap band patients. And as a result, you have to temper their expectations that you may not be able to generate as thin a contour or as defined a contour in that situation as you could in a patient who started off at a lower weight.